Hi, thank you for tuning in to Global Elite Academy. Today we're going to talk about how to open a non-medical home care agency in South Carolina. So first you have to create the structure of your business, either an LLC or corporation with the South Carolina Secretary of State. Then you need to obtain your EIN number from the IRS, which is irs.gov. You need to open up a business account and decide where's your business going to be, in your home office, or are you going to get a special, office for this? You need to get your phone and your fax machine. You could definitely do efax.com. For your phone, I like Grasshopper. Grasshopper is really good because it has a virtual attendant, which makes your business sound very professional. Okay, so you have to, after you do that, you're going to, you got to get licensed. So you have to get your license at the South Carolina Department of Public Health, and I'll put the link and everything on here so that you could get the link. The initial application is $1,000, and then to renew it is $800. That's for your license. So prepare your license. If you're going to have the business in your home, you need to have, a proof of your lease. If you have an office, then you still have to have a proof of your lease, like, your other management company. You have to also show an organizational chart, requests for, usually now, every state is a little bit different, but you have to have a background check. You're going to have that did. But you don't have to have that when you initially put in the license. Okay, let me see. When you're going to have some insurance showing that your agency, is covered with insurance. So general liability and professional liability. All of your staff is going to have to do some type of TB training, TB screening. Tuberculosis, that's the skin test they do. And a criminal background check. So now you're going to go to the South Carolina Department of Public Health and put in your application. After you put in your application, they're going to come out for a survey. When they come out for a survey, you'll have to have your policy and procedure manual. Now, some states, they may test you on that policy and procedure manual through the computer. And then they might come out later to the home for the survey. And usually you need to have a lock cabinet, a file cabinet, where you keep your patients' files and your employees' file. It needs to have a lock on it. And you have to have posted somewhere your business hours, your hours of operations. Okay. Okay. Like I said, for the in-home care provider, non-medical, the initial license fee is $1,000, and then the renewal is annual. and it's $800. And again, I will post on here where you get your license at. Now, if you're going to have your business at home, in your office, in your home, you need a virtual address because you don't want to put your home address on your brochures and your business cards. So you'll need a virtual address. So you could either go to iPostal, you can get it online, or go to any postal office where you could get an address, a virtual address. And you use that for your business address. Again, you don't want your business address all out there in your brochures and stuff. Anybody could get it. So you're going to use a virtual address. And then your physical address, the state, when you apply for your license, they're going to want to know the physical address. So then if like I said, if you're doing it from an office in your home, you would give the state your physical address. irs.gov, where you're going to get your EIN number, you can also give them your virtual address too. You don't have to give them your physical address. If you have an office location, then you don't need the virtual address, because your office location, that would be your address, your mailing address, and your physical address. You'd only need a virtual address if you're doing it from your home. Now, a lot of people ask me, if I'm doing it from my home, how do I interview people? Okay, so now every state is different for your library. So I don't know how it's like in South Carolina, but in Colorado, in the library, they have private rooms, and you could call and reserve those rooms for free for 2 hours. So you could get like a private room and have people to come in there to interview, if you have those at the library. If you don't have the free private rooms that you could use at the library, you can go to a restaurant. Like, you have to order something, but you can when you order something, you're going to write that off as a business expense. So you'll get that back on your taxes. So let's say you made an appointment for somebody to meet you at McDonald's at 10 o'clock in the morning. Well, you can tell them when you get there, they can, order breakfast or just a cup of coffee. But again, whatever you order, you could put it on your taxes, so you'll get that back. And then you'll sit there, they'll get breakfast or just coffee or hot chocolate while they fill out an application and while you interview them. And another place where you could do for interviewing, because you don't want to have people come to your home to interview. So another thing that you could do when you're interviewing, they have, so it's these offices, like one of them is called Regis. I know they're all over the U.S. and different states. But those offices where you could get a virtual address, or you can rent the office by the hour. So usually if you rent those offices by the hour, I don't know what they are now, the price after COVID. Before COVID, you could get them for like $30 for an hour. I don't really know what they cost now, but you rent them by the hour. So you can rent an office maybe if you have a lot of people to interview, you could rent them for like from 9 to 12. Or if you just have one or two, just rent it for a few hours to be able to interview. Another thing that you could do for interviewing is on Zoom. When you go on Zoom to interview them, you have to be able to see them through the entire interview. Because some people like to come on, say a couple of words, then cut off the camera. No, if you're interviewing them, the camera must be on the whole time. And you could do that. A lot of people choose to do that, to choose to just interview people from Zoom. Because again, you're going to be able to see them. Make sure your camera is showing the, all the way from the top of their head to the bottom of their feet, and then you can also see, they can also see you. And yeah, you could do that too if you don't want to go out and get a location. You can just interview them through Zoom. So you could give them your Zoom address and have them make an appointment, let's say at 10 o'clock. They'll meet you in Zoom at 10 and you interview them, ask your questions, everything you want to do. And that's it. Do everything through Zoom. Now, if you need any help with starting your home health agency, you could feel free to contact us. And we have a program that we could take you through step by step from the beginning to the end to teach you how to run your own home health agency. We also start you out with some brochures, about 250 brochures, like 100 business cards. We help you get your EIN number. We help you set up, the phone service. And we help you get a virtual address if you need it. We teach you about each department, human resources, nursing. We just go through each department and train you through each department. We help you with the hiring if you need help hiring people until you feel comfortable with doing it yourself. We teach you how to go out and do evaluations on the patient. And let me see. We do a lot, because like I said, it's from beginning to end. We create your policy and procedure manuals. And if you're doing a non-medical, we will also help you with the Medicaid waiver program. We'll also help you get the certification for that. So we'll help you apply for your regular license, home health license, and then we'll turn around and apply for your Medicare waiver program. So you could do both programs. We'll help you get the license for that. We teach you about marketing. We hook you up with a marketing company that can get you on the first page of Google, where you could get patients. And we stay with you for support for 1 year and answer any questions that you need answering. After the 1 year, the support is $160. But usually in a year, usually in a year, that's a very long time, and you can ask any questions. We help you through the process of asking any question. And there's a lot more. I'll put our information on this in the notes here, so you could contact us if you need any help. Okay, so that's about it. And that's how to apply for your non-medical home care agency in South Carolina.